I'm going to start shortly. So if I can just ask everybody, if you can, to turn off your mics, and then we don't get any background sound and things. And it also might help if you turn videos off just for now. As I say, we're going to record the webinar so that we'll send it to you and everybody in follow up. And obviously, some people might not want their themselves to be on the recording. So if you want to turn your video off as well, it also helps sometimes with the broadband and things. Hi, Ray.
Hi, Chris.
Okay, we're going to get going anyway. So people will no doubt join us. As I say, I just first of all like to welcome everybody. My name's Chris Child, and I'm the Chief Executive at Energize. I'm really pleased to be speaking to you all today. Obviously, it's a very odd time that we're all living in and through, but hopefully this evening we can share some useful information that might help a little bit in terms of supporting you and your local communities. If you want to move that, okay. So a little bit of housekeeping first. As I said before, if you want to mute yourself and turn off cameras before we start, we're going to record the webinar. That's just the slides and when I'm speaking. For others who might not have been able to make it this evening, and we'll send all that to you in follow-up, and obviously you can distribute it as you'd like as well. We will take questions at the end. We're not going to record those questions though, so we'll all turn our cameras back on and things when that happens. But obviously we've got some slides and things to go through. So if you do have a question and you know where the chat function is, if you want to type your question in as we're going through the webinar, and then obviously we'll answer those questions. Obviously, if there are other questions that people want to ask at the end, we'll take those as well. And as I said before, the slides as well as the recording will be sent to all the attendees following the webinar. Okay, that's it. So we're running this webinar in association with Shropshire Association of Local Councils this evening. And I'm really pleased that Ray Wicks, who's the chair of SALC, is here to say a few words of introduction. So I'm going to hand over to Ray now to, are you with us, Ray? Have you got?
I am. I'm unmuted now.
Okay, wonderful.
I'm sticking to your instructions of keeping the videos switched off. Yes, thank you all for attending. Health and Wellbeing is supposed to have been this year, ironically, SALC's main thrust, I think, for the community. As it happens, of course, events have overtaken us, but as a result of that, we're at this level now where we're actually talking to people. So I think it's quite keen and encouraging that we're all starting to talk together, passing ideas around and whatever, and obviously build on what has been achieved over the last 6 months during the COVID crisis. So that's it, Chris.
Okay, lovely. Thanks, Ray. I'm just going to say a little bit about Energize for those of you who might not have come across us before. We're a local charity. We're based in Shropshire. We cover Telford and Wrekin and Shropshire. We're really passionate about the role being active can have on people's lives, not just in terms of the physical and mental well-being, but also friendships and social life, family life can really improve, and work opportunities too as a result of being a little bit more active. So we work with a whole range of partners to try and embed active lifestyles right across society. A lot of the work we do is about enabling and supporting community provision advising on funding, developing, and if local community organisations want to develop their activities and services, training volunteers, making an active lifestyle accessible and welcoming to all. That's what we're about. And as it says there, we're an active partnership, one of 42 across England. Okay, so the purpose of this evening, I'm sure many of you know this anyway, but activity, a lot of physical activity actually takes place in the locality where we live, our local communities, accessing green spaces, play areas, community halls, outdoor gyms, or just walking around from A to B or cycling within our communities. So it's really important that we get that message out about the importance of activity, and we thought you're ideal partners to help us do that. Obviously, you're key local advocates and often caretakers of those local places, and we hope that we can provide you with some information and tools to support your local communities this evening. You'll also know that there are many people in your communities who may not be currently active and therefore suffering as some results as and not receiving the benefits as a result of that. Let's be really clear though, being active doesn't mean having to join a gym or run a half marathon. It's now thought that even 10 minutes of moderate level activity, slightly raising your heart rate, but still being able to hold a conversation can provide benefits. The UK's Chief Medical Officer recently said, there is no situation, there's no age, there's no condition where exercise is not a good thing. It's also been described by him as a miracle cure for lifestyle-related conditions, which are those most likely to cause early morbidity or death. And you can see there's quite a lot of health benefits associated with physical activity and mental as well as physical, as I mentioned. Okay, if we want to go, just move on slide. It's also really important right now. Chris Whitty, who is the Chief Medical Officer, also said recently, exercise is the best thing you can do during lockdown. And of course, earlier in the year, when we went into lockdown and obviously during the spring and summer, when nights were getting lighter and days were getting warmer, it was a lot easier to stay active or get active. And I'm sure, like me, you'll have heard lots of people describing how they found walks that they never knew existed in their local area. Lots of people have told us about that. And of course, some of those people might still be able to access some of those walks, but it's probably becoming less and less so for most during the autumn and winter months. Okay, if we want to move on, just to talk a little bit about current activity levels. As I said, in the early days of lockdown and through the summer, activity levels actually held their own. At around 40% of people regularly doing 5 days of 30 minutes activity, which is the Chief Medical Officer's guidance in terms of improving your health. But during the autumn, these have now dropped below, as you can see, 30%, which is really concerning, both in terms of immediate mental well-being, but also long-term physical health as well. And the levels are worsening, as it says on there, for women, for those with long-term health conditions and or a disability, and for low-income families. Particularly worrying at the bottom of the slide, I'm sure you've noted that the figures we're starting to hear about for children and young people are also dropping, and of course schools are finding it quite difficult to be able to counter that as well. In a minute, Susie's going to share some tools and ideas though, so don't despair. But first, we thought it quite important to share the current COVID guidance around activity. So this was correct as of 21st of October. Obviously, things are changing all the time. Indoor sports for adults, as it says there, from the 24th of September, people aged 18 and over playing indoor team sports must adhere to the rule of 6, which means that playing in a group of no more than 6 people when indoors is the guidance. Indoor sports for under 18s, people are allowed to play in teams of more than 6. So that rule doesn't apply to children under 18. Neither does it apply to adults with a disability. Use of leisure facilities and exercise classes, as it says there, people can continue to use leisure facilities, including indoor gyms, pools, and attend exercise classes within these venues. I hasten to add, they must be venues, obviously, that are COVID secure, so they've been properly risk assessed, etc., which I can tell you all the leisure facilities, public leisure facilities in Shropshire have been. People should not go to those venues, though, socially in groups of more than 6. In terms of outdoor sports played formally and under government-approved guidance, plus outdoor sport and physical activity events following event organiser guidance can continue. So most governing bodies of sport now have guidance to help their various clubs and organisations and associations to exercise appropriately. There is a lot of guidance around about sport and physical activity, and we at Energize, and obviously some of it now is locality related since we've started having these local lockdowns and things. So we try really hard on a day-to-day basis to keep our website up to date. So if you're ever unsure, please go there first off. We make sure we've got links to the government guidance, to Sport England guidance, and to various other sport-specific guidance. As I said, there is a lot of it about. So we hope our website is a kind of one-stop shop to guide you and signpost you to that. If you want to stay connected, as we'll say later on, we're on most forms of social media. We regularly are on Twitter and Facebook, and obviously we'd encourage you to follow us and you will get that information. Of course, if the issue requires more discussion, you can also get in touch directly. We've got a team of experts, and I'm sure one of us will be able to help whatever your inquiry. I'm now going to hand over to Susie, who's our marketing and communications expert, and she's going to go through some of the tools and support that's available free to all. So over to Susie.
Hi everybody, lovely to be here to talk to you this evening. What we've done is we have selected a few resources and ideas to share with you from a recently launched Sport England toolkit. Obviously, as Chris has already said, being active is so important for our mental and physical health anytime. But as we not only head into winter, but also have the uncertainty of this pandemic to live with, keeping ourselves healthy is more crucial than ever. There are 3 kits of resources I'm going to quickly run through, and not all of these are going to be relevant to every area, but you can select those that you feel are most appropriate for your communities. The first of these is Join the Movement, and this was something that was developed when we were all in lockdown back in the spring, with the message, stay in, work out. But these resources are really relevant now, whether we're locked down or not. If you follow this link, and we'll be sharing the slides and this recording, obviously, after the webinar today, you get to a section called Get Active at Home, which includes general fitness, activities to do with the kids, things that are suitable for older adults, as well as specialist advice for pregnant women, those with mental health conditions, and those living with a long-term health condition or disability. A few of the online resources require payment, but the vast majority are completely free. I particularly like the 10 Today series, which are audio or video clips. They're fun 10-minute exercise and stretching sessions hosted by people like Terry, who you can see here in his lovely lime green t-shirt. and others as well. And these are all free. The next set of toolkits is all about We Are Undefeatable. And this is about, as it says there, inspiring and supporting the 1 in 4 people in our country who are currently living with a long-term health condition. And it's about inspiring them to get involved with being active. The range of conditions range from arthritis, Alzheimer's, asthma, cancer, heart disease and diabetes, and was developed by 15 leading health and social care charities backed by Sport England. The purpose is to support and encourage finding ways to be active that work with each person's condition and not against them. This website is packed full of ideas and resources to help anyone living with any of these conditions to get inspired to try something, to have a go at an activity, however small. The message with this is really clear. It's absolutely not about a lot of exercise every single day, if that's not what anybody is able to do. It's about finding something that works for you. One of the lovely resources here is the 15 ways to move more at home poster, which you can see here. Simple ideas people could try, dancing while the kettle boils or doing some bicep curls sat down with a bottle of water while watching the TV. It's just really about finding something that works for you. The third toolkit is a campaign that has been around for a few years now, This Girl Can, and you've probably heard of it. But the message is great and it's still just as relevant now as it was when it launched. Again, it's a really simple message. We need to be active. And as Chris showed in the statistics, women are less active than men. We need to stop worrying about how to do it, when to do it and what we look like. And we just need to find what works for us and get stuck in. The home exercise section of this website focuses completely on free activities which require no special equipment or kit. Stairs, chairs and household objects can be used to create your own indoor circuit class. Home exercise can be just as effective as any costly gym membership and is perfect for anyone who can't get out of the house for whatever reason, whether that's caring for relatives or children, the weather, the need to self-isolate, whatever it might be. I particularly like the personal trainer Ruth's workout in the kitchen using chairs and cans of baked beans. But there are so many free ideas and videos here. There is something for everybody. Chris mentioned that we are prevalent on all the social media channels, particularly on Facebook and Twitter. And our handle on both of those is @Energize STW. And we will be promoting over the coming days and weeks all of those resources that I've just referred to. If you'd like to, please follow us. We will follow you back. And if you're sharing anything with your local community, we'll certainly repost that and support your message too. And now I'm just going to hand back over to Chris.
Brilliant. Thanks, Susie. That's great. So we just, we're very aware that not all town and parish councils are the same in terms of your approach to promoting or developing activities and supporting local communities. So we just had a few ideas that we thought might help you. We certainly don't expect necessarily you to start some great big local campaign yourselves individually, although of course you're very welcome to do that. We recognize that you will have probably lots and lots of local community organizations, some who already provide activities, clubs and associations and the like, and some who perhaps don't, and they may get to different audiences that the activity groups don't get to. So hopefully what we're suggesting is some of this information might be relevant to them, and thinking about how you can get that information to them to support their message, if you like, and their messages. So these are just a few ideas that we had. We don't want you necessarily to feel like it's all your responsibility. We know that lots of local community volunteering groups that have emerged in a response to COVID and lockdown for example, have been communicating using Facebook. The question, I suppose, is whether they might be interested in promoting an active lifestyle too. Clearly, as we said before, it's for many people quite a worrying time over the autumn and winter, and you know, people's mental health concerns and things during that time, and being active can help a little bit with that. We recently saw a survey suggesting that 19% of those COVID groups that have been established during lockdown had offered support to encourage people to be more physically active. So even groups who may not be first and foremost about physical activity might be interested in some of these messages and some of these tools. Okay, moving on. So Susie mentioned the Facebook and Twitter. There are other social media platforms, and obviously we've listed them there. Lots of ways to stay in contact with us. We regularly tweet, as Susie said, about physical activity, both national campaigns and local promotions. We'd always promote anything that you might be involved in from a well-being perspective too. And Susie's email address is on there, and I'm sure if you needed to speak to us, as I said before, if you had a specific concern or issue, we can respond to that, and that email is perhaps the first place to start. So that, I think, concludes the webinar and all we have to say. We, as I said, would welcome any questions.